My name is Jan Tipton. I'm a clinical assistant professor in the School of Nursing at Purdue University. Homelessness is typically measured by a term called a point-in-time count, and that is typically performed in January on the coldest day of the year. And during this day, individuals that are sheltered or unsheltered are counted literally by volunteers, and that number helps the community understand the different numbers that may be affected in their community. In Indiana, in January of 2023, there were approximately 6,000 individuals counted, and this is an increase from the previous year. Nationally, the numbers are exponentially higher, of course, with 580,000 individuals affected by homelessness, and that was also an increase from 2022. When we talk about homelessness, it is a community problem, and we all need to be a part of the solution. And for that solution, we need to not only learn about homelessness in our community, we need to learn about what kind of a problem it is and what type of resources there are available. In addition to that, we need to volunteer. We need to volunteer our time. Homeless shelters are always looking for individuals to help out in any way possible, whether it's serving a meal or helping each individual that's at the center. And then lastly, donate. Donate items such as food, healthy food in particular, and clothing items, which are so essential in the winter months, like coats and gloves and hats and blankets. Unfortunately, in the winter months, if individuals get wet, there is a 20-fold increase in heat loss, which can be devastating. So warm clothing is really helpful to be a barrier for the skin and for the wind. And it's really important that we remember that much of our heat is lost through our head, and so hats are very, very important at this time of year. During the winter season, people experiencing homelessness have threats to their basic needs, such as food, clothing, and shelter. But in addition to that, they have many health-related issues. First and foremost are the cold-related injuries. An example of a cold-related injury is frostbite. And frostbite is when you have local freezing and injury. 90% of the time, it affects the hands and the feet. However, areas of the skin that can also be affected include the ears, the nose, and the cheeks. Those who have hypothermia, on the other hand, have a more significant problem, and this is considered a medical emergency. And unfortunately, approximately 700 individuals die of hypothermia each year that are homeless. So it's a significant problem. And those that are very much at risk are the infants and the older adults, as well as those who have chronic illnesses such as diabetes, malnutrition, and those who have active infections. Those experiencing homelessness are immune compromised and can experience more cases of flu, COVID-19, pneumonia, etc. And lastly, I wanted to mention that people experiencing homelessness do have increased depression, isolation, and loneliness in the winter months. They are separated from friends and family and society in general, so that may be increased during the winter months and the holidays.